Hello to all the members of PCGSA. We are at our March meeting and we're going to be talking about degree plans. There have been a lot of questions arising about certain degree plans for certain programs, questions about what your degree plan entails. So we have coordinators of these programs to talk to us today about the different programs that we have. We have applied, we have the doctoral program, educational, and then we also have school psychology program here. So Dr. Hayes will be talking about the school psychology program, Dr. Ball will be talking about the applied program, and Dr. Curt Carlson will be talking about the doctoral program that is offered here. And is there a master's program?
There's a general master's program, I'll touch on that as well.
General master's program also. So I will open the floor to Dr. Hayes, and then each professor will be speaking after that. Sure.
Thank you, Ida. All right. Well, for school psych, the basic premise, total credit hours needed for the program are 66 hours, so quite extensive compared to a master's degree. We break it up depending on the student and how fast they want to do it. We have a 3-year track, which would basically be a full-time student, taking roughly 3 or 4 classes a semester. You finish 2 years of coursework, and then you go on to your internship. Several of our students don't do it in 3 years. They split up over a 4 or even 5-year period where you take fewer classes throughout your time here. But your final year is an internship in the school district. Or let me repeat, at least half of those 1,200 hours are in the school district. So 600 hours at least in the school district, and 600 hours can be elsewhere. Most of our students do choose to do the whole internship in the school district though. Before internship, our students complete their practicum experiences. There's 2 semesters of our practicum. 1 semester in a school, and 1 could be in a clinic setting. But again, most of our students choose to do both practicum settings in the school since they're going to be school psychologists. There are courses that you need to take prior to you being able to go to practicum. So we call them our core school psych classes, which deals with assessments and consultation. And there's a few other classes that you have to make sure you take before you go on internship. So as you're doing your degree plan, sit down with your advisor and make sure you outline those classes first so that when it's time to go on internship, there are several other classes you can take in conjunction with internship, but most of our students try to get most of them out of the way. I'm not internship, practicum, I'm sorry. So there's a lot of classes. You can be in classes and practicum at the same time. In internship, you have no more classes. You've done all your classes. When students typically come, which is a hard thing because we have students who started either in the fall or you can start in the spring, so that throws off degree plans a little bit as far as what's being taught and when. We have a class 572, which is our Intro to Assessment class. I can't think of the name. What is 572 called?
Intro to assessment?
No, Psychological Assessment and Measurement, 572. That's a prerequisite before you can take the other assessment classes. 573, which is our cognitive assessment. 576, which is, I think call it Assessment of Children and Adolescents, which is like a personality, social, emotional type assessment class. So those are your 3 assessment classes. The first being the prerequisite, and the other 2, the primary ones you're going to use. Consultation, please don't give me on the numbers, I think it's 615, yeah, 615 consultation is another class that you have to take before practicum starts. With the degree plan, we'd like you to fill them out definitely by the end of your first year, but probably sooner than that. The reason being is we want to make sure you kind of understand where you stand and where you're going. We'd like to know how many classes you plan on taking and what route you want to take. So get with your advisor. When you're admitted, you'll be assigned to an advisor, and you'll sit down with that person and go through your degree plan, looking at when classes are typically offered, what semester, and when they're offered. And you kind of, just because you jot down on day 1 doesn't mean that's what you're going to stick to, but it shows us that you've been informed about the classes you need and you're aware of it. We're actually thinking about moving to an electronic kind of format where we can update degree plans at the end of every semester, just because some students do degree plans and then 4 or 5 years later they haven't followed them and they're just a piece of paper in their file. So we're going to try to be more consistent with maintaining degree plans for all our students. There are several classes you take with other areas, with SPED, with applied students assessment. For instance, always applied students in the assessment classes that I teach, and we have diagnosticians from the SPED program in our assessment classes. You're going to get a chance to interact with other students. You just won't be in classes with school psych students when you take most of the classes. And then there are stats that's taken by everyone and all kind of other electives. We use the word electives, but for our program, since it's 66 hours, there's not a lot of wiggle room for electives. So a lot of the classes you have to take because it's state requirement for you to get your license. So you, as a school psych, unfortunately, have way less wiggle room than an applied person or a counseling person or anybody else. We have the hours that you kind of have to take. Now you can always choose to take more classes because you just like to spend more money and take other classes, but we have a set list of classes that you need. What else about degree plans do you think people need to know?
For our internship, do they need to take comps before?
Comps, internship. You typically we suggest you take comps or start comps a year before you go on internship, at least. Some people don't take that suggestion. Reason being, if you cannot go on internship if you're not past comps. You have to have all your courses completed, you have to have comps completed before internship. So if you take comps in the summer and want to go on internship in the fall, that's a big risk, because if you fail summer comps, you're not allowed to go on internship. And we've had to tell students, no, you can't go on internship, because if someone calls us and says, is the student ready to go on internship, we say pending comprehensive exams. And so that's a bad situation to be in. So if you take it earlier, that'll give you more opportunities to get it out the way, get it done, and pass. And you have 2 chances, right? Maybe 2 chances on comps. Maybe 3 if you're lucky, but I know 2 is that kind
Grad
of
school says you can try a second time, and there's a more formal petition process.
So petition if you need it 3 times, but 2 times for sure. For school psych students, our students normally do well on the comps. We have a good rate so far. We have 4 areas of comps that they take over a 2-day period. And we've talked about comps last semester, so please review that tape on comps. But for practicum, you sign up with practicum with, normally it's been me the last couple of semesters on school psych practicum, and we said you find your own internship, you find your own practicum, we don't find them for you. You call local districts. If you're lucky, you can find an internship that pays, but most of them don't pay anymore. And that's a full-time job, so we really stress to students, I know you have a life and you probably have financial issues, but on an internship you have to put in 40 plus hours a week for internship. Unless you make arrangements with an internship site where you can come in 3 days a week, as long as you add it up and get your 1,200 hours. Something that we do require now, even if you get your hours, you cannot leave your internship until the semester is over. Believe it or not, we had a problem with that. So we have made a new rule. So if you're in a school district or if you're in a clinic, just because you have your 1,200 hours, you can't leave your clients high and dry. You have to finish the semester. So you start in, start in August, September, you finish in December when the school is over. And for school districts, their calendars don't necessarily follow the university calendar, so you will be following the school district calendar. So you graduate May 16th, school's not out until June. So unless otherwise given permission by the director at your school site, you're there until June. So just remember that. Practicum was a little more flexibility, but internship, you need to be there. Did I miss anything else about degree plans? All right, stick to them as close as possible. Classes just don't sometimes make, and we'll fill in another class. That's why you have a degree plan, it's flexible. But if a class is offered and it's a core class, it's highly recommended you take it then, because it might not be offered until next year, and it can push you back a whole year. It can put you back a whole year. So don't say I'll take it later. Take it now when I tell you to. And that's all I have about school site. If you have any questions, demarquis.hayes@tamuc.edu. If you can't spell it, I'm on the website.
I'll link it with the video.
Oh, you link it with the video?
I'll write
Okay.
it under in the
Thank
description. Dr. Curt Carlson,
Gosh.
nighttime go.
I will go in any order that you want.
Either or.
This is just a basic Excel sheet that I put together for the 90-hour degree plan, which is the most common degree plan to start on as a doctoral student in psychology here. So most students do come in with just an undergrad degree in psychology. They don't necessarily have a master's degree, and so therefore they're on a 90-hour plan, which involves doing a thesis and a dissertation, as well as a whole slew of coursework, which I'll step you through here in a moment. Occasionally a student will come in with a master's degree in psychology and an empirically conducted thesis from a different institution, in which case our review committee, assuming the student gets admitted to the program, will then review the thesis to see if it's of a good enough level, I suppose, to be accepted. If that's the case, then that student is on a 60-hour plan rather than a 90-hour plan. So again, I'll step through these parts, but the 60-hour plan essentially drops out the cognate here. The cognate is where I'll begin. That's essentially a minor, okay? So that's the only proportion of the degree plan that has non-psychology courses in it, essentially, okay? And the cognate is left pretty wide open as to what a student wants to study, what the student, as long as the student can make an argument to their research advisor or to myself about an area outside of psychology that they feel is linked somehow with their research interests, then that would be their cognate. It's been a wide variety of things depending upon the student, okay? It's been computer science, it's been literature, English for some students. So it can be a variety of things. It can be counseling, it can be special education, it can be things from our own department as well. Okay, so let me go back up to the top here. So we have core courses here at the top, as you might expect. Several just course numbers listed here, not enough space for the full course descriptions. You can go, of course, into the catalog for those descriptions. You pick 7 of those courses basically to fill that core. There are a couple of courses in there, however, that are tied pretty directly to comprehensive exams. So it's not quite as simple as pick any of these 7, because you might skip 620, for example. Well, that's our basic cognition course. You don't want to skip that course, ideally, because it's so tied to that learning and cognition comprehensive exam. Same kind of thing for 509 here, which is the history and systems course tied to that comp. So, basically consult with me at least on an annual basis as you move through this degree plan, okay? It's not ever going to be so set early in your career here where you're going to know exactly which course you're taking which term. We try to have some idea of what might be offered in the near future, but that might depend a little bit. So just keep working with me on it as it develops. The doctoral tools section, those are those statistics courses that Demarquis touched on briefly here. They're not quite as often called doctoral tools anymore, but that's kind of a term from the graduate school. These are courses, especially the first 2 or 3 courses are often cross-listed with other departments here at the university because they're basic stats courses that a lot of different students need to take outside of psychology as well. These cannot be taken in any order that you want. There are a couple of prerequisites built in there. But your first 2 courses should be Psy 612, which is Intro Stats, and Psy 695, which is Research Methodology. And Psy 612, I would say, is more important of the 2 because it opens up the rest of the stats courses. 681 would generally be 3rd. That's intermediate stats. And then for your last 2, you can pick from 3 courses, okay? So you have 610, which is our non-parametric course, 671, which is advanced tests and measures. You should probably have 572 prior to that. And the 3rd one is 670, which is multivariate statistics. So I would recommend picking 2 from those 3 that are appropriate to your research interests, okay? If your intended dissertation is going to involve multivariate statistics, for example, you should probably go ahead and take that course. Okay. Down here, of course, you have thesis and dissertation. So you need a minimum. Now, this is not typically a maximum, okay? Well, it's a minimum and a maximum in a way. Okay, so 6 hours of 518, 12 hours of thesis. Sorry, 12 hours of dissertation. What I mean by minimum and maximum is that you can't have any more or less than those numbers on your degree plan. And that doesn't mean that people don't usually take more than 6 hours at 518, more than 12 hours at 718. It's hard to hit those numbers exactly, but it's a minimum, okay? Once you hit that, you can sure keep on going if you're still working on thesis or dissertation, but it's just, you'll be done with that part of your degree plan. You're not going to be able to add to those hours. Let me see here. I'll conclude with the electives here, and I'll go back and talk a little bit about the master's degree that can be a component here. The last section here, it says elective/core. I don't have the course numbers listed here because there are several electives from which to choose. But in addition to electives that I don't have listed up here as core courses, you can also, once you hit the 7 here for core, there are more than 7 listed here. So if you go beyond 7, then you can throw those into that bottom section. Okay. So a core course can also be an elective in a sense. It's fine to take more than 7 core courses. So they would go into here and just choose among whatever electives you want, basically. But psychology courses, okay. And I don't want to just say psychology courses because typically we don't want. There can be some flexibility there, and students can kind of make an argument for including like a school psychology course here or clinical psychology course, but typically we want courses that are officially listed as doctoral program courses, okay? And there is an official list of electives and core courses, okay? And you can see me for the program description that has those courses listed. Okay. So, 90-hour program, a lot of hours. Students often ask, what about getting a master's degree? Okay, if they come in without a master's degree, do they sort of get a master's as part of this? Well, it doesn't happen automatically. Okay, you do a thesis, you do a dissertation. You have to officially apply to the graduate school for graduation with your master's degree if you want a master's degree officially along the way. Okay, and if that's the case, you wait until you have 36 hours completed, including 6 hours of 518. So 36 hours just from here. Basically, I construct a separate master's degree program for you, and I just take 36 of these hours, not cognate courses, but psychology courses. And I'm looking for certain ones, but basically core courses are fine. Take 36 hours and I make a master's degree plan for you. Those courses, those 36 hours stay here too, but I just make that a degree plan and send it off to the right people at the graduate school, and you can then, when you defend your thesis successfully, and after you get 2 of your written comps done, then you can get your master's degree en route to the PhD if you so choose. Okay, and it's a good idea, just in case something happens and stops you from getting all the way to the PhD. Hey, at least you have that master's degree to kind of fall back on. I'll pause there. Any questions from anybody?
When do you recommend that people start taking cognate courses?
Yeah, so usually students wait on that, and that's a good idea. If you're going to wait, I mean, you have to wait. You can't take a million courses at once. So if you're going to put certain courses off, I would recommend they be cognate courses because they're not tied into comps, right? They're not going to hold you back from really proceeding with your degree plan and your thesis dissertation. The grad school does want your coursework to mostly be done before you enter candidacy and start officially taking 718 hours, dissertation hours. But if you don't have to have 100% of your courses done. There is some flexibility there. If there's a couple cognate courses left, no big deal. But you probably don't want all of your cognates left. But while you're working on your dissertation, you could be taking a cognate course here and there. Right? That makes a lot of sense. So do your psych courses generally first, especially the ones tied to comps. Once your written comps are done, I would say at the latest that's the time to be really diving into cognate. If your written comps are done, you still haven't started cognate yet, you should get on it. Yeah.
Do independent study courses, could they count as cognate courses or electives or both?
Well, if it's an independent study course, but it's a psychology course, absolutely can be an elective. I've seen a lot of that before. It can be a cognate too if it's a non-psychology course. In fact, we've accepted, typically cognate courses would be from one area outside of psychology, but if the right argument can be made that 2 different areas be used, whether they include independent study or not, that's been acceptable for. We've included like special ed and counseling and a sort of a mix there before in a cognate. So there's some flexibility there, but the idea is, of course, to expand a little bit, go outside of psychology and become, sort of expand your expertise and your research avenues.
I can't remember if it's 689 or 675, but one of those you can only take so many hours of that course number, correct?
Well, I wouldn't worry about how the number of hours so much as sort of the benefit of that course. So 675 is the one that you can take multiple times, as long as it's got a different title every time. So it's a course that I've taught a few different times. 675, yeah, it just stands for excuse me, advanced topics, usually within the realm of cognition. 689 is the independent study, I think that's right. But yeah, and 689 you can take multiple times as well, just different topics. No problem there. I've never run into the grad school looking at a degree plan like this and being like, whoa, 675 is on here 4 times. What's up with that? That's never been a problem. I think it's 18 or 21 hours or something like that is the max you take 675. So you don't want your entire degree plan to be 675, but you can take it a bunch of times.
Okay.
As far as cognitive areas, this will probably be helpful for incoming students, but are there areas that you discourage or just don't allow?
For cognate? No, not really. I can't think of any that we've said no to. A lot of students also come in with a master's degree but not an empirical thesis, and the master's degree is not in psychology. Well, they're like, am I going to lose all those master's hours? Well, the place to put them is the cognate, typically. So, you know, hey, if you have a master's degree, if the argument could be made that it's could be tied into the degree that you're pursuing in psychology, then, well, we have no problem typically putting it in the cognate. So that's one less thing to worry about if you come in with a master's degree. One last thing I want to mention here before I take another couple of questions here. Students ask me all the time about face-to-face hours, okay? So yeah, generally speaking, this is, well, not generally speaking, definitely this is not an online program, right? So you do need to have the majority, at least 51% is what you need to be shooting for, of these overall courses to be face-to-face, preferably in commerce, okay? People ask me, well, what if I take something in Mesquite or in McKinney or one of our other campuses? Technically, I forget how many miles it is, but I don't know where the rule comes from. But there's a certain radius of miles outside of commerce, and if a course is taken outside of that, it can't count as face-to-face. So all those, I think, including the Rockwall campus, they're all outside of that radius, okay? So technically, you need to be taking courses in commerce. That's something also to kind of keep me posted on as your degree plan develops. Make sure you're taking enough face-to-face hours, and we have the residency program every June to help you do that. We have, if you take a course occasionally during fall or spring, once a week at 4:30 or 7:15, you'll get your face-to-face hours, so don't worry about that. Thesis, dissertation don't qualify, they're irrelevant when it comes to face-to-face or online. I get that question as well. It just comes to actual courses. Did you have a question?
It was related to
Was
that
it that?
actually,
Okay.
yeah, but it was, so independent studies probably do not count as face-to-face hours then?
Kind of a gray area there. If you're meeting with your advisor, or I'm sorry, your instructor for an independent study, you know, then it can count as face-to-face. I mean, it's not. That's one of those courses that I don't think it's listed anywhere, or if it is, I'm unaware of that it's listed officially as face-to-face versus online. I can't imagine it would be listed as an online course. So yeah, typically that's, and then when I've done degree plans before, it would be a face-to-face course. You know, it's regular interaction with an instructor.
Keep bringing it back to cognate. How does one go about setting up to take cognate courses? Do you have to go to that department, whatever it may be, get permission? How is that?
There's no official protocol for that, really. I'm going through that right now with a couple of students. They'd like to pursue criminal justice as their cognate, and it makes a lot of sense based on their research interests. Well, I've been trying to sort of get a hold of people over there and see how they would handle that. It's not always clear whether other departments will allow non-majors, essentially, people who don't necessarily have criminal justice, for example, undergrad courses of their transcript, they're kind of coming in from scratch. Well, some departments probably won't let those students just walk right into some of their graduate classes. So it's something you got to kind of open up a line of dialogue with them. But with that said, I haven't seen those kinds of blocks arise before.
You don't take comps over cognate?
No, cognate not tested with comps. Right, so 4 sections of comps, we covered that. Right, so that's on the website and all psychology related. Okay, that's all I have.
Dr. Paul?
I forgot my jump drive today. I'll move around from you then. And so I couldn't print off a degree plan unless I went upstairs and got a bunch of them from Aletha, and she'd already left for the day. So what I have here is our old degree plan. Now this is the degree plan that's on the website, so it's the one that any entering person in the master's applied program can go by. But we have modified it a little bit, so I'll go through it a little bit the way Dr. Carlson did his, and although ours is simpler in some ways. It is, in spite of Dr. Hayes' contention that our master's is short, it's 60-hour program, just a little bit shorter than the school psych specialist degree, that sort of thing. Our program is set up originally in our accrediting agency. Don't ask me the name of it, but it's the master's level accrediting agency in psychology. Has suggested very strongly, I think, that we get accredited because we do this, that our model be set up on what's called the Boulder Plan. If you're not familiar with clinical psychology, over a large number of years, a large number of conferences, beginning in Boulder and always in Boulder, I think, to this point, I guess the ruling gurus in clinical psychology have pushed to develop a set of standards for determining what these graduate doctoral programs look like. Their model is the researcher-clinician model, which basically suggests that as you go through that program, and that's true of ours as well, you're going to be focusing on 2 things. 1, acquiring the clinical acumen and skills that you need in order to be a successful clinician, and 2, the ability to understand research and to carry out research. At the doctoral level, there are a few PSYD programs, which are not bad programs at all, but they're pure practitioner programs. Our master's program is not set up entirely like that. Now, we have a limited number of courses that people can take, and so consequently what they end up doing, what it ends up as in order to acquire those clinical skills, is a lot of them are practical practitioner skills. The first thing we do is we ask you to take a core set of courses. These will be courses that you are tested over in your comprehensive exams, and they include personality, the same basic cognition course that Dr. Carlson mentioned a while ago that's part of the doctoral program, and some abnormal learning, no, not learning, that's the cognition course, developmental, and advanced social psychology. Those of you who have undergraduate training in psychology recognize those as very basic kinds of courses. We anticipate that at the graduate level these will be a little bit more intense. In the comprehensive exam process, this isn't always going to happen, but wherever possible, we'll allow you a few questions in which you need to know the core content in order to answer a question that is relevant to the practice of clinical psychology. The courses that we invite you to take in order to graduate, I should say this. One of the courses in the core is ethics, and historically that's been a course that's been across all programs. We now have on the books what I think is an exciting opportunity for us because we're going to be able to teach a course in clinical ethics and risk management, which is very pertinent to the actual practice in the real world of this business of psychology, of clinical psychology. But the applied courses include some of the same ones that Dr. Hayes talked about, and the 572, which is the basic assessment course, and then 573 in cognitive and related kinds of appraisals, and 575, not 576, suggesting maybe just a little rift between school and applied thinking, a course in personality assessment. In addition, you take a course in group psychotherapy, you take a basic course, which amounts to a kind of a pre-practicum course in clinical skills, developing the basic kinds of things that you need to be able to do in order to be successful in clinical conversation and the like. And did I mention group? I think I did. In that same section, we also have psychological statistics, which is 612, the same course that's the first tool course in the doctoral program. We, in the new degree plan, which I've desperately tried to get approved for 2 years now, and glitches, not any fundamental objection to it, that course can be waived if you've already had the equivalent of that at the undergraduate level or the graduate level, if you've had a basic statistics course. That frees you up to, if you feel the movement to do it, to take to write a thesis. It also frees you up to get another elective. And the more electives that you get, which will be of a clinical nature, then you find yourself in a place to have a wider range of job opportunities when you graduate. One of the core courses also is the behavior modification. That's what it says on this degree plan. It's actually, I think, applied behavioral assessment in the current jargon. That course has become so fundamentally narrow that a fairly large majority of our clinical students will probably never be engaged in that kind of activity in their future careers. So consequently, one of the things that's in the new degree plan, and you can go with that new degree plan, all I have to do is modify this one for you. One of the things in the new degree plan that's available to you is, of course, an alternative therapeutic strategies, which is will add to what you learn in the basic skills course, and will get you in a better position to actually have a set of skills that you can use depending on the presenting situation in a particular client's makeup. The final thing that you do is you take 3 semesters of practicum. And these are courses that initially you have to take all of in our on-campus clinic. That's for the first semester. And the second and third semesters, you can, if you secure an appropriate placement, actually work in a field site. There'll always be some link to this clinic as far as the way it's set up at this point in time. But those are pretty important classes. You have to get in those courses 54 hours of direct client contact and 160 hours of general contact, whether it be direct or indirect, but being in the clinic for 160 hours per semester. And that's sometimes difficult to get. The 160 hours apparently are no difficulty. People just sit around and chat. But if you have clients, if you work with clients, that's where you get your 54 direct hours, and that's a pretty key piece to all of this. We are in the process of discussing, if Dr. Hayes were still here, I would discuss it with him right then. I've already discussed it with other members of the committee, of requiring people to not sign up for practicum for the second and third semesters of practicum until they pass comprehensive exams. That protects them. If you're not going to make it through the program, if you decide that it's not for you, you at least will have not taken those last 2 semesters of practicum. So in our practicum, we're exposed to almost every kind of pathology you can imagine. Some of it's actually in clients, and but we see children, we see geriatric patients, we see people with psychoeducational issues, we see people with deep clinical issues of say depression and anxious depression, things like that. I think we have an opportunity in that setting to give you lots of experiences that are really good for your future. Speaking of that future, you can become a licensed psychological associate with this degree plan. You can add a few courses in our electives. The degree plan right now only has as options a 675 course, Special Topics in Clinical Psych. I don't know if anybody's offered that recently. And psychological consultation, one of the ones that's also taken by the people in school psychology. We now have several other possibilities there, including psychopharmacology and the like. So we're trying to make it a little bit more flexible. At the same time, we're not trying to move away from that practitioner researcher model that is sort of at the core of the way we think about things. The other thing that some of our people do, and this is a little more iffy than it used to be because of some things that are happening nationally, and that is you can also, in most instances, sit for the exam to become a licensed professional counselor. And if you're going to do that, you'll be needing to do a little bit more psychotherapy in your work and your practicum, because otherwise you won't have the hours for them to accept you, that sort of thing. I think that's about all I have to say. Are there any questions? Okay, well, anybody want one of these?
Okay, that concludes our March meeting. If you have any questions, once we end this video, please either get with Dr. Curt Carlson or Dr. Stephen Ball, and also Dr. Demarquis Hayes. Please look forward to our April meeting, and we'll be having reminders up on MainSync about that. Thank you.